Welcome back. The health of your herd is important, both for the animals and for your bottom line. Cattleman to Cattleman's Todd McCartney caught up with Dr. Kenton Morgan from Fort Dodge Animal Health to learn more about health protocols for the entire herd.
With spring calving comes a lot of work. Feeding, checking cows, and babysitting those first calf heifers. And after a full dose of this, we begin thinking ahead about better weather and greener pastures. But that's good, because we also need to be thinking about those health management practices that are needed before we go to summer grass. This is good timing to visit with Dr. Kenton Morgan, Fort Dodge Animal Health, about preventative measures that we can do with our cattle in the spring. Let's visit. I appreciate you being here.
Thank you, Todd. First thing that producers need to think about this time of year is to go in with their veterinarian, sit down and lay out a nice program that works best for their management as well as their cattle. And what we'd want to do today is just talk about some real broad general guidelines and have our producers understand that this does not substitute for them talking to their veterinarian.
Gotcha. Let's begin with the calves and their vaccination program for the spring.
Well, with the calves, one of the first things many producers will consider is to give them a Clostridial vaccine before turnout. And this is the typical 7-way or 8-way blackleg shot, as referred to by many of the producers. Clostridial diseases can cause us some serious problems, and so that's one thing we want to consider. Another thing we can consider are the viral diseases, such as IBR, BVD, which we think about reproductive problems in adult animals, but in calves, BVD can be an underlying problem to respiratory disease, and of course IBR is associated with respiratory disease in calves, as well as it can contribute to eye irritation or inflammation that can lead to pink eye later in the summer season.
Dr. Morgan, shed some light on the discussion of modified live versus killed vaccines.
Well, fortunately for producers, we have good products of both. We have good killed products and good modified live viral products. And this is a good discussion, again, that the producer needs to have with their veterinarian to see what works best for their operation.
Are there any respiratory pathogens that we need to be concerned with?
Well, some producers may have a history of respiratory disease after these calves go out to pasture in the summertime. And so some of them may consider using a Pasteurella vaccine. There's Pasteurella hemolytica and Pasteurella multocida. We've kind of changed the name, so it's a little confusing. Now we refer to it as Mannheimia hemolyticum, but in general, think of them as Pasteurella vaccines. The nice thing is that the producer can get these products as single antigen products, or they can get them in combination with viral products. That makes it very convenient.
BQA, or beef quality assurance, it can't be stressed enough. Where does it fit, though, with the calves?
Well, it's a very good point, because no matter how young that calf is, when we start processing them, what we use and how we use it can impact that calf all the way to slaughter. So the producer needs to look at these products, read the label, and whenever possible, choose a subcutaneous route of administration versus an intramuscular route. The other thing that's very important to remember is where do we administer these products. We want to give all of our vaccinations in front of that shoulder along the neck of the calf. Don't inject anything in the hip or really anything in the rear leg at all.
Doctor, how do we decide whether to implant these calves, and does it pay?
Well, I think the first thing to do, Todd, is the producer needs to decide, how am I going to market these calves? What's my best options to sell these calves later in the year? And certainly we know there are opportunities for some of these organic or natural branded beef programs. And with those, if the producer is willing to follow some strict protocols, keep good records, not use antibiotics, not use implants, then they may realize some nice premiums next fall when they get rid of those calves. However, having said that, still we need to understand that about 95% of all the calves are still marketed through traditional routes, such as livestock auctions, private contract. And so in those animals, the implants, even in suckling calves, still offer a very nice economic benefit, because a lot of good studies have shown that you'll see a 19+ pound advantage at weaning in those calves that you implant. And that can relate to about a $20 bill per calf.
So it starts with, how am I going to market the calves?
Yes.
Okay. It's springtime, we think of parasite control. Is it important with the calves?
It certainly is, both internal and external in the calves when they go out to pasture, because they're going to be exposed to a lot of parasites, and there again, that's going to rob some profit from us if we're not seeing them at maximum performance. So spring is a good time, good research to show that there's very good benefits to a spring deworming program.
Doctor, you've lined us out real well with the calves. Now let's switch to the cows.
The mama cow, she needs internal and external parasite control for a couple of reasons. Number one, we're thinking about breeding her back here very shortly. So she needs to be gaining weight and doing well, and that way our conception rates are going to be at their maximum. The other thing to consider is that these cows, the adult cows, are the primary source of contamination in the pasture for parasite eggs. And so if we clean those cows up before they go out to summer range, the pastures are cleaner and our calves are exposed to less parasites that way.
Well, and lastly, we can't forget the bulls. What do you want to share with us?
Bulls, sometimes we do forget them, and we don't want to, because now is a good time in the spring. Typically, we've not turned the bulls in yet, so I like to remind producers to have them semen tested. Very good investment in time and money. If you haven't made that appointment with your veterinarian, they need to do that. Okay. While we've got them in the chute, we can also screen for reproductive diseases such as trichomoniasis, BVD, those kind of things, as well as don't forget to deworm and vaccinate our bulls also.
Okay. Let's put our arms around it and summarize it all.
Well, in the spring with our calves, it's a good time to castrate, dehorn, brand where appropriate. Think about a Clostridial vaccine, perhaps one or more of the viral diseases that we discussed, possibly a Pasteurella vaccine if they've had some history of respiratory disease. We also want to deworm those calves, and if we're in a setting where we're going to market them through a very traditional route, then implants can be very economically beneficial. For the cows, deworm, consider vaccinating those cows. It's important to vaccinate our cows for reproductive disease before breeding season, 30 to 60 days. Both the Academy of Veterinary Consultants and the National Cattlemen's Beef Association Task Force on BVD recommend that the best time to immunize cows to prevent reproductive loss with BVD is prior to breeding season. So that's another important consideration. And then, of course, last but not least, our bulls, get them up, semen test them, vaccinate and deworm them, and get them ready to go.
Well, Doctor, we appreciate your time today. Once again, we got another expert with good advice for us in the springtime.
It's important to consult your veterinarian when creating your own herd health program. For more information on getting your herd ready for summer turnout, go to cattlemantocattleman.org.